Taking care of someone with diabetes doesn't have to be overwhelming. I've got the essential tips that will make it easier than ever. Caring for a loved one with diabetes can be a challenging and emotional experience for both the caregiver and the person living with the condition. It requires a great deal of time, effort, and dedication, but with the right approach, you can make a significant difference in your loved one's life. As a caregiver, you play a vital role in supporting your loved one's health and well-being, and with the right knowledge and skills, you can help them manage their diabetes more effectively. In many cases, caregivers are family members, friends, or neighbors who take on the responsibility of caring for someone with diabetes. This can be a daunting task, especially if you have limited knowledge of diabetes management. However, with the right guidance and support, you can become an informed and confident caregiver, capable of providing the highest level of care to your loved one. Diabetes care can be complex, and it's essential to have a clear understanding of what's involved in managing the condition. As a caregiver, you'll need to be aware of the different types of diabetes, the signs and symptoms, and the various treatment options available. You'll also need to understand how to monitor blood sugar levels, administer medication, and adapt to changing circumstances. It's also important to remember that caring for someone with diabetes is not just about managing the physical aspects of the condition, it's also about providing emotional support and encouragement. Living with diabetes can be frustrating and isolating, and your loved one may need someone to talk to, someone to share their feelings and concerns with. As a caregiver, you can play a vital role in providing that support and helping your loved one to cope with the emotional challenges of diabetes. When it comes to caring for someone with diabetes, having the right tools and resources is essential. You'll need to have access to glucose monitors, test strips, and other diabetes management equipment. You'll also need to have a clear understanding of your loved one's medication regimen, including the types of medication they're taking, the dosages, and the timings. Additionally, you'll need to have a solid grasp of healthy eating principles and be able to prepare nutritious meals that are tailored to your loved one's specific needs. One of the most critical tools in diabetes management is the glucose monitor. This device allows you to check your loved one's blood sugar levels regularly, enabling you to make informed decisions about their diet and medication. You'll need to understand how to use the glucose monitor correctly, how to interpret the results, and how to adjust your loved one's treatment plan accordingly. In addition to glucose monitors, you'll also need to have a solid understanding of your loved one's diet plan. This includes knowing what types of foods are beneficial for people with diabetes, how to portion control, and how to prepare healthy, balanced meals. You'll need to be able to read food labels, identify hidden sugars, and make informed choices about the foods you're preparing for your loved one. Another essential resource is a comprehensive understanding of diabetes management. This includes knowing how to administer medication, how to adjust dosages, and how to recognize the signs and symptoms of hypoglycemia and hyperglycemia. You'll need to be able to identify the warning signs of diabetic complications, such as nerve damage, kidney damage, and vision loss, and know how to respond accordingly. In addition to these essential tools and resources, you'll also need to have a clear understanding of your loved one's prescription medication regimen. This includes knowing the names of their medications, the dosages, and the timings. You'll need to be able to identify potential medication side effects and know how to address them. Now that we've covered the essential tools and resources, let's take a closer look at the structured approach to managing diabetes care. The first step is to monitor blood sugar levels regularly. This involves checking your loved one's blood sugar levels at specific times of the day, such as before meals and at bedtime. The next step is to administer medication as prescribed by your loved one's healthcare provider. This includes insulin injections, oral medications, and any other prescribed treatments. You'll need to understand how to administer each type of medication correctly, how to adjust dosages, and how to recognize potential side effects. Meal planning is another critical aspect of diabetes management. You'll need to be able to prepare healthy, balanced meals that are tailored to your loved one's specific needs. This involves understanding the principles of healthy eating, being able to read food labels, and identifying hidden sources of sugar and salt. In addition to meal planning, you'll also need to understand how to encourage physical activity and exercise in your loved one. This includes identifying safe and suitable exercises, understanding the benefits of regular physical activity, and being able to encourage and motivate your loved one to stay active. Let's take a closer look at what's involved in monitoring blood sugar levels. This involves using a glucose monitor to check your loved one's blood sugar levels at specific times of the day. You'll need to understand how to use the glucose monitor correctly, how to interpret the results, and how to adjust your loved one's treatment plan accordingly. Next, let's look at preparing a balanced meal. This involves understanding the principles of healthy eating, being able to read food labels, and identifying hidden sources of sugar and salt. You'll need to be able to prepare meals that are tailored to your loved one's specific needs, taking into account their dietary restrictions and preferences. Administering insulin is another critical aspect of diabetes care. You'll need to understand how to administer insulin injections correctly, how to adjust dosages, and how to recognize potential side effects. You'll also need to be able to identify the warning signs of hypoglycemia and hyperglycemia and know how to respond accordingly. In addition to these practical skills, it's also essential to have a clear understanding of how to communicate effectively with your loved one. This involves being able to listen actively, being empathetic and understanding, and being able to provide emotional support and encouragement. One of the most effective ways to communicate with your loved one is to use open and honest language. This involves being able to express your concerns, being able to listen to their needs and feelings, and being able to work together to find solutions to common challenges. Another critical aspect of diabetes care is encouraging a healthy lifestyle. This involves being able to promote physical activity, being able to encourage healthy eating habits, and being able to support your loved one in making healthy lifestyle choices. One of the most common challenges caregivers face is dietary issues. This can include managing carbohydrate intake, dealing with food cravings, and navigating social situations that involve food. You'll need to be able to provide emotional support and encouragement, helping your loved one to stay on track and make healthy choices. Medication side effects are another common challenge caregivers face. This can include managing hypoglycemic episodes, dealing with insulin resistance, and navigating medication adjustments. You'll need to be able to identify potential side effects, know how to address them, and be able to work with your loved one's healthcare provider to find solutions. In addition to these challenges, caregivers may also face emotional and psychological challenges. This can include dealing with feelings of guilt, anxiety, and frustration, as well as navigating the emotional impact of caring for a loved one with diabetes. You'll need to be able to recognize the signs of burnout, know how to prioritize your own self-care, and be able to seek support from family, friends, and healthcare professionals. Let's recap the essential steps for caring for a loved one with diabetes. Firstly, you'll need to have a clear understanding of diabetes management, including how to monitor blood sugar levels, administer medication, and prepare healthy meals. You'll also need to be able to communicate effectively with your loved one, providing emotional support and encouragement. In addition to these essential steps, it's also important to remember the importance of patience, understanding, and empathy. Caring for a loved one with diabetes can be challenging, but with the right approach, you can make a significant difference in their life. If you found this video helpful, be sure to like, share, and subscribe to our channel for more informative videos on diabetes care. Share your experiences in comments below, and don't forget to check out our other videos for more helpful tips and advice. Thanks for watching.